welcome to our very special show, Health and Wellness Myths and Facts. I'm Ambika Singh Kama. Even though in Omicron we have a variant which causes a mild infection, it can affect the vulnerable and the people who have not received the booster dose. Due to Omicron's high rate of transmission and danger to unvaccinated and people with comorbidities, hospitalizations could rise in the coming months. People with chronic diseases should be more careful about the management of their conditions during this phase. Chronic diseases are the major cause of death and disability worldwide. The total number of people dying from chronic diseases is double that of people succumbing due to infectious diseases. The two most common and leading causes of death are diabetes and heart disease. Altered lifestyle is a common risk factor in all major chronic diseases. With the pandemic, chronic diseases are on the rise, and people are increasingly turning to social media for health information, which may not always be reliable. Advice from our experts will help our viewers get medically correct and actionable information so that they can act accordingly. So if you have any questions you would like to ask them, please send them to us via WhatsApp to the following number, which is +91 91 67 666 941. Yes, that's the number to send us your questions for our experts. Also, do not forget to send us your name and your location. Today we have with us, let me introduce them to you. We have with us Dr. Sugunapriya, MBBS, PG DIP, Diet Consultant, Diabetologist, SP Diabetic Foundation, Coimbatore, and Dr. Randeep Nayyar, MD, DNB, Cardio Interventional Cardiologist, JK Medicity Hospital, Jammu. Thank you all so much, doctors, for joining us today. Starting with you first, Dr. Priya, we have a question from one of our viewers sent over WhatsApp. The question is, my dad is 83, he's diabetic, but well controlled, for the last 28 years with medication and diet. He's not on insulin. He just tested positive for COVID, but it is very mild. But his sugar shot up to 484. We had to admit him to the hospital, and within 24 hours, it's 180. Has COVID triggered the spike in his sugar levels?
Yes, we are already in an epidemic of diabetes, and in this, our COVID has taken over a pandemic role. And COVID infection, as such, it gets attached to the certain receptors called ACE receptors in the body, which are abundantly present in the pancreas, lungs, livers, and the small intestine. So, getting attached to this increases the inflammatory response of the body. It enhances the autoimmunity. It also causes this ACE down regulation. So what happens is there is a reduction in the insulin secretion from the pancreas. So along with this, a spike of the cytokine release also increases the insulin resistance. So what does this insulin resistance mean? It means that whatever insulin you have, it will not be able to work properly. So with reduction in the insulin secretion, with insulin resistance, and along with the stress of having an infection and immobility, all these factors contribute to the increased blood sugars in a COVID-infected patient. So in fact, now we see a lot of new patients with new onset of diabetes after COVID infection. It's very common nowadays. So people have to be careful in maintaining the social distancing, wearing a mask, and taking the proper booster doses, whatever are needed.
Okay.
So this will definitely help them to avoid having a worst case of infection, and always have a check of their sugars with their diabetologist and keep the sugars under control. This also will help them achieve a healthy thing along with a healthy lifestyle with diet and proper fitness exercises.
Okay, thank you for answering that for our viewer. Moving on, Dr. Nayyar, we have another WhatsApp question from one of our viewers. How long will a test show positive, either RT-PCR or RAT, after completing an isolation period of 7 days with no symptoms?
Yeah, actually it depends upon the severity of the symptoms and the viral load. The more the viral load, the test may be kept it for a longer time. And if the disease is mild to severe, mild to moderate, and it may last for about 10 days. 10 to 12 days is a usual time in which the RT-PCR test, if comes positive, it becomes negative after the onset of symptoms. It has been seen also that patients who are immunosuppressed, who have decreased immunity response, what they actually, it has been seen in experiments that in various studies also, that patients who are diabetic, who have a severe kidney disease, are immunocompromised, they usually show this positivity even up to 42 days. So it depends upon the severity of the illness and the viral load. Usually, for mild to moderate disease, we can say the person usually becomes negative or the PCR after about 10 to 12 days.
Okay. Sure. So it can keep showing negative, but they are not infectious and they do not pass on the infection. Am I right on that?
Yeah.
Okay. 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 Yeah. So moving on, Dr. Sugunapriya, what is the role of genetics in the causation of diabetes, and when should a genetic test be done?
Yes, diabetes, we have common types called type 1 diabetes, type 2 diabetes, and other rare forms of diabetes like monogenic diabetes. Type 1 diabetes is a multi-genetic trait, so we have to do a lot of furthermore evaluation to find out the family traits. But still, when you have one of your family member having type 1 diabetes, the risk of getting diabetes or type 1 is 6%. So always there is a small increased risk of having a type 1 diabetes if you have a family history. And if a man has diabetes of type 1, the chances of having his child having diabetes is 1 in 17. And if a woman has diabetes and her chance or odds ratio of having a child with diabetes is 1 in 25. And if they have some polyglandular syndrome or similar things, so in that case, the risk is doubled. Whereas in type 2 diabetes, it's definitely having a genetic origin. So whenever you have a member in your family having diabetes, there is an increased rate of at least 2 to 3-fold increased risk of having a diabetes. If one of your family member has diabetes, then the risk is more than 40%. And if both the members of your family, parents that mean, have diabetes, then the risk is almost more than 70%. This is further evident from the concordance rate in the monozygotic twins, where the rate is around 60 to 90%. So, yes, next question is whether we'll be able to do genetic testing in all the individuals. But practically, this is definitely cumbersome and it's not possible. So, where this genetic testing will be helpful is in this rare form of monogenic diabetes. This is also called as the maturity onset diabetes of the young. In these cases, the onset of the diabetes will be earlier, that is earlier than even in childhood or adolescence or in less than 25 years of old, but they'll have a strong family history. So these people have to be checked for the genetic testing, and these people will be inadvertently, they would have been started on insulin. So by doing MODY testing, we can shift them to oral drugs. This is really a great boon to them, because taking an injection every day will be definitely difficult for them. So taking a tablet will be an easy boon for them. So for MODY patients, definitely doing a genetic testing will be more helpful. Almost there are around more than a dozen types of MODY discovered now, and it's being done in all the specific centers. So this can be easily done. Now moving further, we are also doing genetic testing to understand how the drugs work for certain people. So this will help us in near future maybe to choose the drugs according to their genetic sequence. And this is where the precision diabetes is moving on. So genetic testing and added to diagnosing this MODY, it also will be helpful for guiding the treatment also.
Okay, thank you so much actually for explaining that really well, that how the genes can affect diabetes and about testing as well. Moving on, Dr. Nayyar, what is myocardial infarction and which symptoms are recognized as common warning signs preceding a myocardial infarction?
Yeah. Myocardial infarction, as we know, in our literal meaning, in common language, we call it as a heart attack. Heart attack is a major illness of the heart in which there is an impaired supply to the heart muscles. What happens whenever there is a critical supply to the heart, there is ischemia of the heart, that is decreased blood supply causes symptoms like you have a chest pain, you have palpitations, patient can have sweating, and the pain, it is usually felt in the chest. It is type of tightness, it's a squeezing pain, and the pain may radiate to your neck, it may go to your jaw or back, and some patients, they also experience pain in abdomen during a heart attack, and that is a typical symptom. So the symptoms usually they are variable, ranging from pain in the chest to the pain to the arms, and sometimes to the back also. And if the heart attack is severe enough, the patient may come in a drowsy state, in a comatose state to the hospital. And in elderly patients, especially in elderly and diabetic patients, it can be a silent angina only. And the patient comes with some lethargy, he may come with drowsiness, or he may come with only shortness of breath. And there's a difficulty in breathing, and he's feeling uneasy, he's uncomfortable, and sometimes it is difficult to evaluate the symptoms of heart attack in elderly patients. So they don't come with classical symptoms of heart attack like chest pain, or you have difficulty in moving around, because whenever you move around, the pain increases. So these are the common symptoms of heart attack. Patient, as I already told you, that it may present silently also. That's called a silent heart attack.
Okay. So
and we have seen many patients who come to the hospital just for routine checkup, and we on routine examination or routine investigation, we find out that the patient has already suffered a heart attack in the past.
Okay.
So it may come silent also.
Yeah, silent also, but one must keep a track and must be aware of the symptoms so that they can reach in time. In case of an emergency, they can reach a hospital in time. So on that note, we're going to be taking a very short break. We'll be right back. Welcome back. You're watching Health and Wellness, Myths versus Facts. Dr. Sugunapriya, no matter what type of diabetes you have, it can lead to excess sugar in the blood. Too much sugar in your blood can lead to serious health problems. How does this excess sugar in blood cause damage to the body, and why is it really essential to control this?
Yes, almost we have 537 million people with diabetes now, and our body has around 30 trillion cells, and all these cells will be bathed in the excess sugars when the sugars are on the higher side, and the cells are not made or not built to manage this when it is on the higher side. So what happens in each and every secretion event, the sugars will be high, even your sweat, even your tears, even your saliva, everywhere the sugars will be high. So from the head to toe, each and every cell will have a high blood sugar. So what happens is these sugars will go set on the proteins, they'll form advanced glycation end products, then they'll form free radicals, and all these will induce changes in the each and every cell. So what happens if the sugars are high in the oral cavity, that's in the mouth? You see when the mouth is with high sugars for a long time, what happens is a lot of unwanted yeast and bacteria will grow there, and you will get gingivitis, dry mouth, burning sensation in the tongue, and later on this periodontitis will develop, and your teeth will get loosened, and you will have an early loss of tooth. So you can see a lot of young adults whose diabetes have got unattended with loss of teeth in an early stage. So similarly, if in the urine the sugars are high, then the patients are prone for recurrent urinary infection and the genital tract infection.
Okay.
And acutely, if the sugars are very high, then they'll be landing up with diabetic ketoacidosis or hyperosmolar states. So this will be definitely a difficult situation where they have to get admitted and get treated in a proper hospital. And coming to the chronic complications, because of all these products, that's what the advanced glycation products and all the inflammatory changes, what happens will be the small blood vessels, the very small blood vessels in the body will get affected. It will get thickened. The small endothelial cells that line these blood vessels also will get affected. So what happens is the sensitive eyes, kidneys, and the nerves, the peripheral nerves, all will get affected. So
Okay.
resulting in diabetic retinopathy, nephropathy, and neuropathy. So coming to the retinopathy, you see the second cause of blindness is diabetes. So it's because of the unattended sugars. We see a lot of patients who would never see, never take care of their eyes even, and never check their eyes. And if the diabetes gets unattended, definitely it will go damage the cells, the retinal cells in the eyes, and later on it will cause a blurred vision, and finally in the proliferative stages or when the bleeding has occurred, then
So it
they'll
does
end up
affect,
with
like you rightly
blindness.
explained, doctor, it does affect. I mean, it's important to control sugar levels and also keep a check and to understand if you're having high sugar levels, because you've really explained it well, that how it impacts and affects the body. Moving on, Dr. Nayyar, severe heartburn and heart attack can be hard to tell apart. You have told us the symptoms of a heart attack. So tell us, how much do the symptoms of heartburn and heart attack overlap? How different are they?
Yeah, it's a nice question. Because in our community, we have seen a lot of patients coming with symptoms of heartburn, and they are sometimes misdiagnosed as having suffering from heart disease, and vice versa also. Patients, they are coming with chest pain and usually going to quacks, and they get some antacids there, get a slight relief of the symptoms, but actually they are suffering from heart disease. So the symptoms, they are very much overlapping. So it is very difficult to sometimes diagnose clinically also that whether a patient is suffering from heart disease per se or he is having gastric symptoms. Okay. So whenever a patient of retrosternal discomfort or retrosternal pain comes to us, especially in the vulnerable age group, like he's diabetic, he's suffering from kidney disease, or he is more than 50 or 60 years. So you should always think of heart disease rather than a heartburn. And these things are cleared when we do routine investigations. Even a simple ECG can put diagnosis in our hand, and we can then further evaluate him for heart illness, especially the angina part or ischemic heart disease. We can evaluate him further with other tests like troponins, and we can do echo, and later on advanced tests also.
Okay. So like the
but
symptoms...
definitely it is a very much overlapping disease in our community, because we have seen that patients of heart disease, they are coming very late to us.
Yeah, because the symptoms are very similar.
They don't come immediately to our knowledge, and they go on taking these antacids and other things for gastric problems. Okay. But later on it has been found that they have suffered a heart attack.
Yeah. So I think that's a very key point which you put out there, Dr. Nayyar, that the symptoms are very similar, all the more that a person or a patient should be careful to look out and to go for preventive checkups. I think that's very important. Dr. Sugunapriya, the key to diabetes management is to keep a check on blood sugar and keep control of it. What is the extended version of the ABCs of diabetes?
Yes, actually, ABC is an attractive phase given to the patients to have the sugars as well as the other metabolic disorders to be taken care of, because diabetes as such, the definition itself is saying it as a metabolic syndrome. So it means that not only controlling the sugars, it should also take care of the blood pressure, which stands for the B, and the cholesterol, which stands for the C. It should be taken care of. A stands for HbA1c, and HbA1c is nothing but the 3 months average sugar level, which we can check with the blood. It is nothing but the glycation of the red blood cells, which lives for around 90 days, and the level has to be kept less than 6.5 if applicable, and if it is kept in such a level, we can avoid the complications of diabetes. So coming to the blood pressure, it could be a systolic blood pressure and diastolic blood pressure. That's what we normally measure. Actually, less than 120 or 80 is the level which is needed. So keeping the blood pressure under control will save your hearts, your even your kidneys, and the other avoids the stroke. So definitely keeping the blood pressure is always needed. And next comes the cholesterol, which is a very common term we will see. It could be from the food what we take, or it could also be intrinsically produced. So keeping the cholesterol also under control is much needed. Most of us are misled by the myths which go around. Taking statin will affect your kidneys, but please don't go by that, because when you have diabetes, as Sir said, we always have a silent heart attack at bay. So having cholesterol will definitely increase the deposition of the fat in the small blood vessels, and will make lose its elasticity and make the blocks very easy.
So I think the ABCs, it's very important to also keep a check on the ABCs, which you just said, HbA1c, the blood pressure and cholesterol. So thank you so much, Dr. Sugunapriya and Dr. Nayyar, for joining us today. And thanks so much, viewers, for sending in your questions. Please keep sending in your questions and our experts will answer them for you. A lot more on the other side.